Hello, good evening, everyone. Today we are going to speak regarding the osteopathy and how the healthy aging should be. Osteopathy refers to the branch of medicine that focuses on the body's musculoskeletal system and its role in overall health. We'll see which all the factors are affecting bone health. The first factor which is affecting the bone health is nutritional factor, in which mainly the low intake of calcium, magnesium, and vitamin K and vitamin D is important. In lifestyle factors, the physical activity, smoking, and alcohol consumption is included. In medical and hormonal factors, the hormonal imbalance in females, menopause, and thyroid diseases are important. In genetic factor, ते हे झालं. In genetic factors, age related genetic and age related factors, the genetic problem, age, and gender with body weight, it is important. Next, please. In aging, and what, how the aging affects the bone health, we'll see. In bone density naturally declines with age and increasing in the risk of fracture and osteoporosis. Proper nutrition and exercises and medical care can help to maintain the bone strength. Osteopathic care focuses on the holistic approaches to enhance the bone health and mobility. We'll see how the changes in bone, muscle, and joint occurs with the age. What happens in bone with the age? In bone, there is decrease in the bone density, which is in mild form it is called as osteopenia, and in severe form it is called as osteoporosis. Bone becomes brittle and fragile, slower bone remodeling process, and increased risk of fractures, especially at hip joint, at wrist joint, and in the spine. We'll see what all changes will occur in the muscle with increasing age. In muscle, there will be loss of muscle mass and strength in old age people. Muscle become weaker and smaller, reduces the endurance and flexibility. There will be like very slow rate of healing and recovery after the injury in old age patients. We'll see what all happen in the joint in old age people. The cartilage wears down, causing the joint stiffness, decreases in the synovial fluid, and which reduces the lubrication of the joint. There are ligaments, which ligaments and tendons will become less elastic. Increased risk of osteoarthritis and joint pain will be there. We'll see the conditions which will occur in the old age people. The first condition is osteoporosis. Osteoporosis is the condition where bone becomes porous and fragile due to reduced bone mass, increasing risk fracture risk. The next condition which occurs in the increasing age in the joint, it is called as osteoarthritis. There will be a degenerative joint disease. Osteoarthritis is a degenerative joint disease where cartilage wears down, leading to pain, stiffness, and reduced mobility. There are chances of fragility fractures, like brittleness will be increased in the bone. So, break that occurs from minor fall or stress, commonly affecting the hip, spine, and wrist in elderly individual with weak bones. We'll see what is osteomalacia. Osteomalacia is softening of bones due to vitamin D deficiency, causing bone pain, weakness, and increasing the fracture risk. Which all strategies are there for the improvement of quality of bone in old age people? We'll see the strategy of bone health improvement exercises. There are varieties of exercises are there to increase the bone health and the strength of the bone. The first is weight bearing exercises, which include walking, jogging, or hiking, dancing, and staircase climbing. The second is strength training, in which resistance band exercises will be there, free weights or machines will be there, body weight exercises, which includes push-ups, squats, and lunges, balance and flexibility exercises, which include tai chi, yoga, and heel to toe walking. And in core strengthening exercises, it is planks and bridges, which are main important factors of nutritional intervention for bone optimal bone health. It includes balanced nutrition provides the essential building blocks for strong and healthy bones at every age. The first and most important thing is calcium, the core mineral of bone. We will get abundantly the calcium from milk, cheese, yogurt, ragi, sesame seeds, green leafy vegetables. The next important minerals are magnesium, zinc, and vitamin K, which supports the formation and mineralization of nuts, seeds, green leafy, and we'll get these from nuts, seeds, and green leafy vegetable and whole grains. The proteins are which are very important for the bone matrix and muscle support. Needed for the collagen formation and muscle maintenance, we'll get these from the pulses, dairy eggs, and lean meat and tofu soya bean seeds. Vitamin D is also important, which is abundantly uh, occupied from sunlight, fortified milk, egg yolk, fatty fish and fish supplements. And we require the supplements if needed. Which all nutrition we have to limit? We have to reduce the salt intake. We have to reduce the caffeine intake. We have to reduce the cola, and we have to cut down the smoking if we do. The most important thing is hydration and gut health. Adequate water intake and a healthy gut improvement, which improves the nutrient absorption. When to visit the doctor? I'll tell you some conditions where you have to consult your doctor. The first is persistent joint or bone pain there is there, then kindly visit your doctor. If there is difficulty in movement or stiffness, if there is frequent fracture of bone and there is bone weakness, unexplained swelling and inflammation is there around the joint or any body structure, there is numbness, tingling or weakness, and postural changes or height reduction is there, kindly visit your doctor. Thank you. Thank you so much.